Good morning, and thank you for joining us for the April 28th virtual COVID-19 news conference. My name is Mariah Miracle, and I'm a public information officer in the Humboldt County Joint Information Center. I'll be moderating today's news conference, and let's start by introducing this week's participants. Humboldt County Health Officer, Dr. Ian Hoffman, Family Nurse Practitioner and Humboldt County Vaccine Task Force member, Lindsey Mendez, Arcata City Manager, Karen Diemer, Emergency Services Manager, Ryan Derby. Each panelist will now give a brief update on what they've been working on in relation to the COVID-19 pandemic before taking questions. Let's start with Vaccine Task Force member Lindsey Mendez.
Hi, Humboldt, and thank you for having me here today. A quick update of what we are doing with the vaccine committee is that, number one, we are encouraging everybody to go onto My Turn right now to get their appointment. And we would like to remind everyone that sometimes we will be switching where clinic locations will be. And if you have gotten a dose at the Arcata Community Center through public health, then you should return this next week to get your shot. And if you would like a first dose there, please go next week or this week to get a shot. And I would just want to remind everyone to go onto My Turn and to look at the schedule of when you can go and get your vaccine. We also would like to talk about how we are going to do a vaccine clinic at the Fortuna High School on Saturday, this Saturday, and it's going to be 10 to 2 p.m. And all are welcome. And you can, again, go on to My Turn and look for this site so that you can get vaccine if you live in that area or if you're just passing through. So those are the two big updates for scheduling. And moving forward with that, I would like to remind everyone that the mobile clinic is going to be starting on May 3rd through the public health branch. This clinic will be taking a van with vaccine to numerous parts of the county. And we would encourage anyone who is interested in this service to contact the public health branch and call the JIC at 441-5000 if they are interested in this. And we will hopefully be adding many more communities to our schedule as we move forward. So that is my update for today. Thank you.
Thanks, Lindsey. Ryan, can you share an update?
Yes, good morning. Today I'm just going to provide a brief overview of the various funding streams that the EOC has been using for the past 13 months to fund the COVID-19 response. There have been some inquiries over the past few months, past year, asking about how we're paying for this, inquiries into staff time, equipment and supply costs. So I just want to provide a brief overview of several of the grants and federal and state dollars that we're using to fund this. Our EOC finance team has been actively seeking and managing a variety of different grants for the past year to fund the COVID-19 response. We currently have a public health emergency preparedness base grant and supplementary COVID grant that's paying for several staff members' time, as well as some ongoing equipment and supply costs. Hospital preparedness grant program that is providing supplies for healthcare entities, as well as the response and some staffing time. Various epidemiology laboratory capacity grants that collectively have brought in about $6.1 million to fund the ongoing response to COVID-19. This has provided additional hiring for staff to help with the ongoing vaccination effort, additional staffing for the laboratory, along with some additional equipment for their testing and ongoing response equipment and supplies. And then we also have received notice from FEMA that they're going to be covering 100% of eligible project costs, which means that all of the overtime that's accrued from the beginning of this incident ongoing will be 100% covered from FEMA, as well as what we call Category B costs or emergency protective measures. Those will also be 100% covered through the federal government. I think the reason this is all important to brief out on is that it shows that after this is all over, our county government is still going to remain whole. Our jurisdictions that are putting money into this response are going to be financially whole, and that the ongoing cost of COVID isn't going to essentially bankrupt the jurisdictions that have participated in the response. So I think it's important for the public to know that there is a sufficient amount of funding to keep this going, and that all of the costs to date have been fairly well covered through supplementary funding, either from the state or federal government or through grant opportunities. And that is all I have to report today.
Thank you, Ryan. Karen?
Great, thanks. Good morning, Humboldt. Just wanted to give a quick update on sort of where Arcata's focus is right now. We're, I would say, sort of focused on two branches. One is internally from the city's operation, is focused on safely reopening additional activities. So summer activities that will include our parks and our playgrounds, our sports fields, our recreation camps and programs. And we are moving into really looking seriously at special events. So I'll talk about that a bit at the end. Our second focus has been on supporting our businesses as they more fully reopen and will be staying open through the summer. We do still have money in our what we're calling our job retention loan program. So this was a loan that was created to assist businesses that were affected by COVID-19 and to retain those jobs. So the loans are from $25,000 to $140,000, and they must be used for purposes that just clearly relate to your business's ability to survive during COVID. But if those jobs are then retained for a 6-month period, then the loan is forgiven. So it actually converts to a grant. So we're still working with businesses that are struggling after, now being closed or affected for over a year to try to get over this last hurdle until they can get reopened and that revenues can start coming in. The city does meet every other week with the chamber and with Main Street and the university so that we stay coordinated on our efforts to respond. So if you are in the Arcata area and have questions, feel free to reach out to the city, or if you're connected to Main Street of the chamber or the university, can certainly get messages on what is needed in terms of support out there through our support agencies as well. That group is originally worked on the initial plans to support outdoor dining, and that group is really doubling back to work with all of our restaurants to support a strong outdoor dining season as the weather warms up in Arcata. And I'd say the most common question I'm getting right now is, will there be a Crabs baseball season? So I think Ian and I can safely report this morning that there will be a Crabs baseball season. We're doing the final walkthrough with the Crabs on the field next Friday to make sure that we have everything in place. But all of the cities right now are actually coordinating around special events. So as opposed to each individual activity having to go through the certification process, we have identified about 15 venues throughout the county. And so we're working with Dr. Hoffman and his team to be able to certify each venue, and then the cities can work with the individual event holders. So on events, if they would like to hold them at the venues. I can't speak for all of the cities, but I will say in Arcata, we will have, we're working on 5 different venues, and our council has been supportive of those venues to support nonprofit events, but also for-profit businesses that cannot hold some of their traditional events in their indoor spaces to also be able to utilize these outdoor venues. So if you are an event promoter and are interested in holding an event, small or large, please reach out to the jurisdiction that you're interested in holding that event in, because all of the cities I know are eager to work with people to have some local opportunities for events this summer here in Humboldt County. So I think that is our update from Arcata, but I'd be happy to answer any questions that you might have.
Thanks very much, Karen. Dr. Hoffman.
Thanks, everyone. Thanks for being here today and inviting me to talk about the COVID response. I just want to use my time today to update where we're at in the last few weeks. I think we all recognize we've seen a bit of a change in COVID over the last couple of weeks, with our case counts rising, our hospitalizations rising. Really emphasizes that we are definitely not out of the woods yet with COVID. There has been an identified super spreader event here that was linked to specific events in Humboldt County. We have now over 40 cases that were identified linked to that specific event. And dozens more that have come from the interactions of people from that event with others in our community. And so, and on top of that, we've seen now 20 hospitalizations associated with this current outbreak. We've also identified that the UK variant is in our county, which is something we have suspected for a while, but now have confirmation of that. And we are highly suspicious that this event that we're seeing currently is related to a likely variant of concern spreading in our community, given the high hospitalization rates, more severe illness, and how rapidly this is spreading. So I think it's a good reminder that the kinds of things that we're doing to try to make safe events in indoor and outdoor spaces, like Karen was mentioning, the city's working with public health to implement CDPH's guidelines are still extremely important. They are there to protect us as we continue the vaccination effort that Lindsey mentioned, as we try to get more and more people vaccinated and we get closer to our goal of having a more protected society. At this moment, we still have large portions of our society who are vulnerable to this disease because they either haven't been vaccinated or maybe they were never exposed to it, or even they were exposed to a different variant that now a new exposure could continue to get them sick and allow them to spread it to others. Public health firmly believes that the guidance that we have from the state, from CDPH, will help protect us. So if we continue to follow the guidance around gatherings, around events, around how we act in public places, we should be able to prevent outbreaks like this in the future. So thank you for the opportunity to address that.
Thank you, Dr. Hoffman. Let's move on to questions from reporters. Please try to limit your conversation to a single topic. And if other reporters have follow-up questions on that topic, they can ask those after. And a reminder that we have a hard end time of 10:30 this morning. So let's go ahead and start with time standard, Isabella Vanderheiden.
Hi, thank you very much for taking my question. Does DHHS have any more information on the UK variant? And the press release seems to imply that there is only one case. So is that accurate? And also, is this a breakthrough case?
Yes, we've only identified one case in Humboldt County. We suspect that there are many more. The UK variant is the fastest growing variant in California currently, based on statewide data. We are waiting more samples from the last few weeks to come in, and we'll update, as we have, when we have information on it. It was not a breakthrough case, though. It was, and it wasn't associated with any larger event or travel or anything like that, which is why we suspect that this has been circulating in our community for probably at least the last month, if not longer. And it does date back to early part of April.
Thank you. That's all I have for that subject.
Thanks, Isabella. Taylor Elliott, Redwood News.
So just kind of a follow-up to what she was asking. So then what the case that has been identified, when is that sample from? Versus like how long do you think it has been circulating in the community?
Yeah, so that sample dates back to early April. And because it's not associated with anything like travel or larger gathering, I would suspect that, we have had the UK variant circulating in our community for weeks, if not a month before that. And that, that's consistent with what the CDC and CDPH has been saying about the UK variant, that we should expect to see it overtaking other variants in the US around that time in late March or into April. And certainly now the data statewide is very suggestive that the UK variant has overtaken the West Coast variant that we were seeing predominantly starting in around January.
So that was my follow-up question, but my actual question is, so I know that we have resumed using the J&J vaccine. And so just now that that's back in circulation, can you just talk about whether people should be skeptical about it or if they should trust the effectiveness? And then just again, like a review of the chances of those rare blood clots.
Lindsey, do you want to speak to that? Oh, pardon me. I'm sorry, Dr. Hoffman, go ahead.
Oh, no, I was going to say, Lindsey, you want to talk about that?
Sure. Hi, everybody again. So yes, the J&J vaccine did come back as a vaccine that we can use safely in our communities in the United States. We have gathered enough information about how this disorder or process happens and how rare it is, even though it is serious. And we understand that now we can have shared decision making and we can talk to our patients about if they would like to have this vaccine based on this very rare risk of blood clots, specifically women of childbearing age. And we would encourage people to explore the options of also Pfizer and Moderna if they feel more comfortable with that. If they don't, and then I would just encourage everyone again to understand that this is a very rare occurrence and it is a safe vaccine that we can use in our communities, and that we are putting this warning on it because we are such a safe society that we would never want to just forego a warning that we have gathered through data. And with that said, we would like to continue to distribute this throughout our county and utilize it in the way that the CDC and CDPH had originally recommended. Thank you.
Thanks, Lindsey. And so just to put into perspective for you some of those numbers. So, there were, when it broke down to how many cases per million, it was a few cases per million in the age group of women age, 18 to 50. What we see though, when we look at the risk of COVID in that same age group is that, deadly blood clots from COVID itself would be hundreds of times more likely. So when we think about the risk of the vaccine versus the risk of COVID itself, it is outweighed. And then there's a larger impact to society for everyone who's vaccinated, less risk for other people in our society who are vulnerable, less chance of our hospital beds getting full with COVID patients. So those were some of the things that were looked at in the determination of recommending that Johnson & Johnson be continued to be used in all age groups. And like Lindsey said, just putting out information that this is a known risk, just like there are other known risks of anaphylaxis or other vaccines carry known risks that are rare, and as well as other medications that we use that have known rare risks. But we always want to weigh the benefit of the medication or the vaccine versus those risks. And in this particular case, both for the individual and society, all levels of review of this from the federal down to the states level determined that those risks were small enough and the benefits were well outweighed.
I do have one more question about vaccines, but it's slightly off topic. So can I ask that now, or should I wait until we go back around? Yes.
You can go ahead and ask it now, Taylor. Thanks very much for being
so then I know, Lindsey, you mentioned the vaccine clinic in Fortuna that's coming up. Do you guys still expect a big turnout, even though there has been a downtick in people getting vaccinated lately?
We do not know exact numbers of who is going to be coming to the Fortuna clinic, but what we do know is that we set our goal to be 200, and we have over 100 people registered already for this clinic. And at any point, if we went over 200, we can have more come. and we can open up the clinic for more people. So as much as we think that we are having a huge slump in people getting vaccinated, we also know, as Dr. Hoffman has spoken about before, that my turn was an adjustment period. We have to get people signing up online and registering. And also we're using the goal of going to many different locations throughout the weeks so that we can hit as many regions as possible. So I think it's going to start to stabilize again. Thanks.
That's all the questions I had. Thank you.
Thanks, Taylor. KMUD News, is it Lauren Schmidt? Are you with us, Lauren? Oh, all right. We'll move on to Stephanie McGeary from the Lost Coast Outpost.
Hi, thank you. Sticking a little bit with the vaccines topic, I'm wondering, do you have any internal estimate about how much of the population will flat out refuse the vaccine, like a percentage?
Dr. Hoffman, can you speak to that?
Sure. It's hard to estimate something like that. This is a new vaccine. It's never been seen before. So even basing it off of other vaccination efforts in the past would be fraught with lots and lots of problems. I think, if we look at national and statewide trends, there's definitely a suggestion that upwards of 80+% of people are willing to accept the vaccine. Our efforts are going to be to continue to break down barriers to the vaccine so that people who can't get to a site, have difficulty because of their job or maybe transportation issues, maybe they don't have a doctor who they can discuss things with. Maybe they just hadn't heard about My Turn because they're not on the internet. And so we're reaching out through other avenues now, through local emergency services, through schools, through other organizations in the community. So I think that we're at a point where certainly the people who were well connected to information in society knew how to get the vaccine and have now gotten it, and now we're having to get out to people who didn't have as much access in the past. So we're going to keep vaccinating as long as people are there to show up for any clinics.
Thank you. I think that's the only question I have on that topic. Thank you.
Great. Thanks very much, Stephanie. Riley Carroll, North Coast News.
Hi there. Thank you so much. So I have two vaccine questions. First of all, do you have an estimate for, it looks like there's a trend kind of nationwide of people getting their first dose, but then not returning for their second. Do you have any local data on the number of people that have received their first dose, but have missed their second dose window?
I don't have specific data I can point to, but from being pretty intimately involved in the vaccine effort, I'd say it's pretty low overall. Lindsey, do you have any specific numbers we can point to?
I do believe that the no-show rates is the easiest way that we were utilizing our data, right? When we could look at PrepMod specifically, when we were using PrepMod before we were using My Turn, which is the new platform, we can measure how many people just did not show for their appointment for their second dose that was scheduled. And they are actually very low rates. I think that they were below 10% on maybe the worst day was a 10% no-show rate. It can feel extreme when it feels like a lot of people are not coming to their appointments. But in reality, when you're giving 1,000 second doses in a day, and then you look back on the data, it is not as severe as what a lot of sources are saying, especially in Humboldt County. Although we are afraid that people will not return for their second dose, and we really want to encourage everyone to try to get their second dose appointments in an appropriate amount of time so that they can reach full immunity.
Yeah, and I'll add to that while there is some protection with that first dose, and you know, we don't want to underestimate that, you know, that one dose is helpful. It's certainly not fully protective, and that people really should be getting that second dose to get that full protection. And then, you know, any of the recommendations that are coming from CDPH and CDC around fully vaccinated people do require that you've had that second dose of either Pfizer or Moderna, and then 2 weeks has elapsed from that second dose. Or now that J&J is back available, you know, getting that one shot J&J, and then 2 weeks later you'd have full protection. So yeah, I agree with Lindsey. I think it's well under 10% from what we've seen so far in the data from early on, and you know, that fits what I've seen, you know, from our data internally, and we'll continue to put up the second dose, first dose data on the dashboard as well, which you know, tracks over time how we're doing with certain age groups and populations.
Thank you so much. And just one last question. Do you at all worry that the demand for the vaccine will decrease so low that it's unlikely for Humboldt to reach herd immunity?
I think that we will continue to do whatever we can to break down whatever barriers exist. Again, you know, the vaccination effort is one that will continue for a long time in Humboldt and in California, as we reach out to different groups and organizations that just haven't had a chance yet to get in. You know, I think that when we will know when we've reached herd immunity, or when we have reached a level of vaccination that is comfortable for our society, when we stop seeing you know, large outbreaks, when we stop seeing hospitalizations at the rate we're seeing them, and we have no idea what that number really looks like, to be honest. I think, you know, there's a lot of people guessing what that means, but you know, from a scientific standpoint, we just don't know. This is a new disease. This is nothing that we've seen before. So there is no point in which we stop trying to reach for more vaccination.
Thank you.
Thanks, Riley. Kim Ware from the North Coast Journal, thanks for joining us.
Sorry, can you hear me?
We can hear you.
Okay. Flipping back to the outbreak that happened, can you talk a little bit about sort of where we stand on that right now as far as containment? Are the cases we're seeing now still appear to be tied to that?
Yeah, we are still seeing cases that are offshoots of the original outbreak. You know, I think overall, we could be reaching a point where, you know, you know, there's enough of this spread out into the community. If people can follow the rules and the regulations that are set forth, I think that it can be contained. You know, we're hopeful that everyone who was exposed will follow their isolation and quarantine orders that have been put out there, and then continue to follow gathering and event guidance that's you know, been put out by CDC and CDPH to help contain the spread of this.
Any follow-up questions, Kim?
Sorry, I was muted again. A little bit how it spread. I mean, you said there were 40 original cases and then dozens others. I mean, just to give people an idea of how a super spreader event works. In the sense of, you know, people went and maybe they went to a friend's house and then it spread to there, sort of how that process works.
Yeah, definitely. So, a super spreader event is really exactly what you just said. So we have a very large gathering of people, sometimes in the hundreds or maybe even 1,000 or more people. And those people are exposed. They don't know they were exposed. They go back to their homes. They gather with other groups. They gather with families. They go to work, they go to restaurants, and it continues to spread from there. So, there are, like I said, dozens of other folks who are secondarily infected now that we can tie back to the original events, and, either through specific individuals that they were exposed to, or family relationships that they had with individuals who were originally infected. We're coming up on several weeks out from the original event, so I don't think we're seeing any more from new infections from that event, but people who are, out in society and either didn't know that they were exposed or infected, are continuing to spread this. And so again, if we, continue our masking, our distancing, follow the guidelines around gatherings and what we do in public spaces, I do think that we will contain this and be able to get back to on track of where we were, a few weeks ago, before this occurred.
Just one last question. I don't know if you could talk a little bit about kind of what it took for the contact tracers and stuff, sort of what kind of an effort it was to really try and track down the people. Well,
yeah, so we have a large staff on contact tracing and investigations. We were starting to scale back on that. We've had to scale back up now, but luckily we've had experience with this over the course of the pandemic, scaling up and rapidly. So they went right into action, calling people, interviewing people. We have had participation from organizations and businesses, getting the word out to people who are exposed. So that's really helpful. I think the thing that's the most helpful, though, is that when people get a call from public health, they get a call from an investigator, they give information about where they've been, they give information about their contacts, because that's how we trace down the next level and try to stop it before it spreads further out into our community. So really encourage everyone who gets a call from public health, please participate and please give us as much information as you can. It'll help protect our friends and family. It'll help protect our community. It'll help protect our businesses from needing to stay open, and stop the spread of this disease.
okay, thank you very much.
Thanks, Kim. I think that's everybody we have here today. So we'll go back to Isabella. Any additional questions from the Time Standard?
Yeah, so I actually do want to know a little bit more about that Eureka Pentecostal super spreader event. So I guess I would like to know, what the real origin of it was. So is there any evidence that the initial exposure was related to out-of-town events that were, maybe limited to 1,200 guests with lax mask wearing?
So we are looking into potential link to other events across the state. Humboldt County Public Health is working with CDPH and a state team to investigate further. But we do know that the local spread does appear to be associated with church services throughout the first few weeks of April here locally.
Okay, and then a slightly different direction, because cases are surging locally, how does DHHS Dr. Hoffman feel about relaxed CDC guidelines, and is there concern that we could move back to the red tier?
Yeah, I think that the new CDC guidelines that just came out around masking look really reasonable. I know CDPH is looking at those right now. We're waiting for CDPH to give their and California state government to give their final word on how California is going to adopt those new guidelines. They're really more of a risk assessment based on multiple different factors of whether someone's indoor or outdoor, whether you're in a large setting, large gathering setting or a small setting. And ultimately, really the most protective factor is vaccination status. If you look at those guidelines that came out yesterday. And I think that's a really important thing to recognize, is that our path forward is really vaccination. If you look at those risk assessments. So we'll update folks on how that's going to play out in California. I do suspect that, whatever CPH comes up with, we'll adopt here locally and endorse here locally once we have that determination and can look at that, what those policies are. As far as moving backwards, I know there's a lot of concern for this particular event potentially causing us to move into a more restrictive tier. I don't think that's likely at this time. There have been a lot of changes in the blueprint that do make it more difficult to move to a more restrictive tier because of the vaccination status and the fact that massive hospital surge is unlikely, even though we are seeing a surge of cases. To see the overwhelming kind of cases that we had seen, internationally and even here locally in southern parts of the state of California, just is very unlikely at this point. But I think that that doesn't take away from the fact that we've had 20 hospitalizations in the last few weeks, that we really can tie back to these events that that does impact our services locally, and it impacts our community and our family members. So we're out of the woods in terms of that large surge event that we might have thought we would see months ago, but certainly with a portion of the society who's unvaccinated, really still a lot of potential for people to get sick and potentially get hospitalized.
Thank you very much. And the last thing I would ask you is, have we seen any more breakthrough cases in the county?
Yes, we have seen more breakthrough cases, and I would suspect we continue to see them. Still mostly mild to asymptomatic.
Okay, thank you.
Thanks, Isabella. Taylor Elliott from Redwood News.
I don't have any more questions.
Great, thanks, Taylor. Stephanie McGeary from Las Coast Outpost.
Yes, this was already addressed in part, I believe, but the fact that we have remained in the orange tier despite this recent surge in cases and in hospitalization. You spoke to Dr. Hoffman, that being that having to do with our vaccination rates and the risk of future hospitalizations. But did the fact that most recent cases were tied to the super spreader event have anything to do with staying in the orange tier? Do state officials take that into account, that a big surge in cases came from one single event or group when they're doing tier assignments?
They do not. It is based on epidemiological metrics that have been set around case count and percent positivity of our testing in the county. The biggest change, there was two main things that have changed since the governor announced changes to the blueprint a few weeks back. There was the tie to the vaccination rates statewide and the lowest quartile HPI, which moved the case rate thresholds higher for each of the tiers. So that has benefited, allowing us to remain in the orange tier. The other really big one was that in the past, it could have been either your case rate or your test positivity rate that would move you in a tier, and now it has to be both. So both case rate and positivity rate have to be in a more restrictive tier to go backwards, and that is not something that we're seeing currently. So I do think it's unlikely that we would move backwards. And if we did, it would be because we're seeing really widespread disease that it was difficult to contain beyond an outbreak. So that was part of the thinking at CDPH around why they relaxed those rules, is that we know we have a large portion of protected population. And if we see outbreaks in unprotected, unvaccinated parts of society, that it wouldn't lead to, again, these massive hospital surges like we saw back in the winter months.
Thank you. Again, this was already kind of addressed, but since Karen Diemer spoke a bit about bringing back some special events, I'm wondering, has there been a lot of talk about requiring a proof of vaccination or a recent negative COVID test to be able to attend events such as the Crabs baseball games, things like that?
Oh, I lost you. Do you want me to try that one, Dr. Hoffman? So, we are in the planning for each venue really following the CDPH guidelines. And so for outdoor events, we are really looking at social distancing, masking still, ingress and egress, really trying to keep people seated. So for example, at a baseball game, or even we're working right now with the Oyster Festival as well, we're going to have people that have assigned seats. You come in, you're in your seat. Even at the Oyster Festival, we're working where you would, place your order and then those oysters would come to your table as opposed to you going to each booth. So we're really looking at how do we limit contact and keep the event participant in one place and bring, the parts of the event that need to come to their table or their seat to them. For the indoor gatherings, we're just starting to work with a couple of event promoters that would like to put on some, private events, some weddings or retirement parties or, company picnics, those types of things. And on those private events, there is discussion about whether or not vaccination or testing requirements would be made. And a lot of that will depend on sort of the indoor versus the outdoor venue associated with that, but all really tied back to the CDPH guidelines right now.
Yeah, thanks, Karen. And if you look at those guidelines, which are posted on the CDPH website, and which Humboldt County is encouraging all events to follow, and we're not planning on making anything more restrictive right now. When you look at those guidelines, they do allow for increases in capacity for events that are entirely vaccinated or tested or a combination thereof. And that includes business sectors having, say a restaurant with a totally vaccinated night, could increase their capacity, or a bowling alley could have a similar type of event that was for vaccinated or tested folks. So I encourage everyone to go look at that and put those into guidance, because I think that, again, what you'll see is that the kinds of spread that we're seeing from this particular event, super spreader event, would be prevented if we had more vaccinated and more tested people in those events.
Thanks, Stephanie. Riley Carroll from North Coast News.
Thank you. So kind of coming off of the, testing at large events and stuff, are we at a place where if cases, I guess, increase again, even marginally after allowing for Crabs baseball games or larger events, are we at a point where we will just kind of continue to vaccinate and open up, or will we, maybe stop those events or something? Like at what point are we just going to kind of like proceed and keep vaccinating even if we see a case increase? Will that happen?
Well, for now, we still have the blueprint. And so the blueprint does allow for us to move to more restrictive tiers if we see case rates and test positivity going up in meeting those thresholds to become more restrictive. So, the governor has talked about June 15th as a date that they would like to remove those restrictions, as they feel confident that by that time enough people will have been vaccinated, that our hospitalization rates across the state will have been low enough to allow for even less restrictions than are currently in place. And I think also hopeful that some businesses and local jurisdictions will continue to use these really smart measures to protect our society, until this whole pandemic is much more well controlled, and we continue to get even more people vaccinated into the summer and fall months, as we expand the vaccination eligibility beyond just 16-year-olds into younger and younger folks. So it's really goes back to the blueprint. I think what your question is that it would depend on our case rate and our test positivity rate that would put us back into a more restrictive tier.
Thank you.
Thanks, Riley. Kim Ware from the North Coast Journal.
Yeah, back again to the Eureka Church. You mentioned the UK variant that appears to be a factor, you think, in the way this is spread and the severity?
We don't have any evidence right now that a variant is involved in this particular outbreak. The only one that we have was not associated that we can find with anything to do with the events at the church. But I think the speed at which we're seeing the spread and the hospitalization rates are suggestive that a variant could very likely be involved. So we're investigating that, and if we have any updates on that, we'll definitely let everyone know.
And then one last question, a little bit off, but you just mentioned right now we're at 16 and up. Is there any idea when it might go down to like 12 and up before school starts? In fall?
Lindsey, you want to take that one?
From what I understand of the state call this week, it should be they were thinking June is the possibility of expanding the Pfizer. Although again, they just don't want to publish anything because they are not sure.
Right. And I say that as the mother of a 14-year-old. So.
Yeah, I think we're definitely hopeful, as soon as we have the data to support it, it'll happen. We want this to be safe. We want it to be well studied. It's near, the next group is definitely 12 to 15-year-olds for Pfizer. And, as we get more data for each of these trials, for each of the different vaccines and different age groups, they'll be looking to open up the EUA for each of those groups. So.
Great. Thank you so much.
Thank you, Kim. We've just got a few more minutes here. I'd like to offer the panelists an opportunity to give any closing thoughts and perhaps share why, from your perspectives, your jurisdictions or agencies, vaccination is important in general, or why you personally got vaccinated. So let's go ahead and start with Dr. Hoffman.
Yeah, I, personally, I'm vaccinated because I want to protect myself, first of all. But my family, I have small children who are unvaccinated, can't get vaccinated yet. So I want to protect them. I want to protect my family members, some of which who have health conditions that, put them at higher risk for COVID. And I want to protect our community from this disease. I want to be able to go to Crabs games and Oyster Festival and feel safe. I want to be able to, go out more and hang out with more people who I haven't seen in over a year. So those are the reasons personally. And I think that, as a society, we're going to fare much better. Our businesses are going to be more open. we'll be able to increase capacity at all the events that we know and love over the course of our time here in Humboldt County. Thank you.
Thank you, Dr. Hoffman. Ryan?
Well, I just want to thank our media representatives for the thoughtful questions today. I appreciate this new format. It's nice to actually have some live questions when we do these, but I have nothing further. Thank you.
Thanks very much. Karen, would you like to share any closing comments?
Sure. So I've got 6 days left until my 2-week wait period is, and I'll be fully vaccinated. I guess for me, I mean, I'll just ditto what Dr. Hoffman said, you know, certainly for family and certainly for our community. It is extremely hard to support the operations of a city from a telework or a Zoom platform. So I have had to be out and about in the community, of course, for the whole year. And so I was very much looking forward to getting the vaccine and feeling safer being out in the community and being, I guess, more engaged within our business community as we move forward and open. I also just really want to put a shout out to the nurses and the support staff that have been operating the vaccination center at the Arcata Community Center. I know many of them have come into our community from out of the area, even out of state. And they have just done a fabulous job. So I feel fortunate. I want to thank Public Health for operating that center here in Arcata. We're getting a ton of credit for the vaccine effort and really doing none of the effort, none of the work, the heavy lifting. So thanks to all of you, and really encourage people to utilize that site and that center. They are efficient, they are quick. I've heard people get in and out in, you know, under 5 minutes until they're in their waiting period. So on site. So it is so easy to get vaccinated, and County Public Health has made it very accessible, and really hoping that everybody takes advantage of it. We anticipate a pretty full and robust tourist season up here on the North Coast. We saw our hotels fill quickly when travel restrictions within the state of California were lifted kind of midway through the pandemic. And we anticipate, especially with a further opening coming June 15th, that we are going to see a very full tourism season. So my challenge and my hope to this community, really all of our communities in Humboldt County, is that we can show those tourists how we have been able to remain open safely by masking and social distancing and supporting our businesses in that way, and encourage those tourists to spend their money here.
Thanks very much, Karen. Lindsey?
Yeah, it's hard to compete with all of the other responses, including Dr. Hoffman's and Karen's and Ryan. I believe also in the fact that we get vaccinated so that we can live better lives, so that we can spend time with our families when there is a disease process present that is hurting people. And I think back on all the other vaccines I have ever gotten in my life and why we have gotten those vaccines and why we've done major efforts around the entire world for things like polio and influenza and Tdap and DTaP and every vaccine we give, because how wonderful is it that we have one shot that can stop us from being sick so that we can live better lives with people not dying of these diseases, and how genius it is that we get to use this technology. And I think it's so wonderful, the entire effort, starting from the first scientist who made this vaccine to putting these shots in arms everywhere around the world to stop this pandemic right now. And I think that's why I got my shot.
Thank you very much to all of our panelists and our media representatives. We will provide a recording as soon as possible, and I wish you all a great day.